Betsy, is it live yet?
Yeah, and caption, or could you please type something so we can make sure that captions are coming across?
Oh, here it is.
Wait, is the audio on again?
Betsy, is it live yet?
Okay.
Caption, or could you please type something so we can make sure that captions are coming across?
Somebody's got YouTube on. All right, that was great. I'm going to give you Wanda the host duties and jump off here.
Great. Is the audio on again? Something so we can make sure that captions are coming across. Everybody's got YouTube on. That was great. I'm going to give you one of the host duties and.
Good morning, everyone. We're going to get ready to start here. Just wanted to remind everyone that we are streaming live on YouTube. Please keep yourself muted until speaking, and we hope you will keep your cameras on. When speaking, unmute, and please introduce yourself before your comments or questions for the audience and for the record. I will now take a roll call. Unmute and just let me know you're here. Richard Bagby.
Good morning.
Heather Board.
Good morning.
David Seafew.
He's there.
Oh, I see him. He's talking on. He's on another
finishing
meeting.
another meeting.
Okay. Rennie Delaney. I believe Rennie is going to be joining us in a few minutes if he's able. He had court this morning. Kathy Hayfield.
I am here. Good morning.
Morning. David Reed.
I am here, but not there.
Okay. Josh Sloan.
Just jumped in. Good morning.
I see. Good morning. Our guest today.
I'm here, and I'm just literally finishing my other Zoom, but I'm listening attentively.
Okay, great. Thank you. Marcia Dubois.
Good morning. I'm here.
Morning. Chris Miller. She's here. Carolyn Turner.
Good morning. I'm here. I'm here.
Good. Donna Cantrell.
I'm here.
Also in attendance today, behind the scenes running our YouTube, is Betsy Civilette, and our captioner for today is Leora Grassel. I will now turn it over to Dr. Seafew. Are you ready to go with the welcome and introductions?
Actually, the last speaker is going on just a little bit, so I apologize. If you could take over and introduce people, I will be able to get on in literally 2 minutes.
Okay, well, the next thing is actually the approval of the, we're good, I'll take care of it. So the next thing we're gonna do is approve the December 3rd, 2021 meeting minutes. If there are no changes, it can be approved by consensus. Are we all good with that? Okay. Any changes?
Nope.
Good. All right, the next thing will be the adoption of the March 11th, 2022 meeting minutes, which is the agenda for today. If there are no changes, are there any changes anyone would like to mention?
Nope.
Okay, it is accepted and approved by consensus. Now is the public comment section. I did not receive any public comments, so we will move on to the financial report, which is also me. So for just a sec. it's on the screen. Chris is sharing the expenditures and revenue report. So CNI expenditure report for 3/11/2022. And this will be for the previous 3 months. So November 1 through January 31. Grant payments equaled $166,340.75. DAR's administrative payment $70. So total expenditures for the past quarter were $166,410.75. Revenue received over the last quarter, $171,471. Interest, $21,5536. For a total received $173,626.36. Revenue minus the expenditures, $7,215.61. So trust fund balance on 10/31/21 was $3,156,980, plus net activities from the past quarter of $72,1561 leaves us a current balance of $3,164,196. Average revenue on 1/31/22 was $62,375.19. 1 year ago, revenue averaged $54,835.24, which was an increase of $7,539.95. Current cash balance, $3,164,196. Cash balance a year ago, $2,821,543, which is an overall increase of $342,653. Anybody have any questions?
So Wanda, this is Kathy Hayfield.
Yes, ma'am.
So that's the monthly revenue that we're receiving now in the trust fund. The 62,375
That is the average. yes.
average monthly revenue.
Yes.
Okay.
And Wanda, that's an increase, obviously, from last year, but that's overall down from pre-COVID. We were in the 70 to 80, which is maybe there's less driving, right?
Yeah, I believe you're correct on that. But yes, it is an increase from the COVID, during the COVID, but before COVID, it was higher. Yes.
This is Kathy Hayfield again. At one time, it wasn't it as high as 100,000 a month?
Oh, that was many years ago, I believe.
Yeah, I've been around many years.
Yeah.
Yeah.
Okay. I'm sorry. Yep. Any other questions? All right, we'll move on. Oh, Dr. Sifu is still on his other meeting, so we'll move on to the grantee presentations. Let me make sure that's the next thing. It is. First up today, Brain Injury Connections of the Shenandoah Valley, Cindy Nofsinger, Executive Director, and Jen Devon, Clinical Director, are going to give us an update on looking out for little brains, comprehensive pediatric case management. Chris, do you have their PowerPoint ready?
I do, but I'm not sure they're here, Wanda.
Wanda, I am back on full steam and ready to go. I apologize. And hopefully this will be the last quarter that I have the conflicting meeting. Wanda and I are working it out. So, all right. So the little brain, I mean, the people discussing about the little brains aren't on yet.
Let me make sure. Okay.
I was going to say that about Dave Reed, but I knew that would be too odd. That's a softball.
All right. So let's, Chris, would it be okay if we let Amal go? Are you all set, Amal?
Yes, we are.
Okay, great.
Yeah. Why don't we start? All right, then I'll introduce her. That's all right. So
Yes, that's great.
yeah. Thank you. All right. So our out of order grantee presentation, we'll have Dr. Amal Carmarker from VCU. Will speak on transitions and disparities in care and outcomes in neurotrauma. Dr. Carmarker, to you.
Yeah.
And if we could get his slides up.
Yeah, thank you, Dr. CPU, and thanks, Wanda and everyone for the invitation. So basically, we are going to be doing like kind of a tag team. My colleague, Dr. Ajmain, she'll be talking about what are we planning to do next, and basically I'll be talking about what we have done so far as part of the contract that we have through DARS. So next slide. Next slide, please. Yeah, thanks. So I'd like to acknowledge, obviously, the support that we've been receiving through DARS, and basically we are very excited for the next next initiative in that particular series, which Dr. Ajman will talk about. Next slide, please. So we basically been working on several different data sets which are specific to brain injury in Virginia. And I joined the project about a year and a half back. And basically, as part of that that project, what we are doing is we are looking at 4 different data sets. So we are looking at Chris. Can you go back to one slide, please? Yeah, thank you. So we are basically looking at 4 different data sets: the Virginia Statewide Trauma Registry, or the VISTER. We are also looking at the all-payer claims data set, which is by VDH, and Virginia Department Health Information is the contractor for that. And basically the VISTER, it's a trauma registry, and as I described, there are like a unique identifiers. That's how we can identify individuals with traumatic brain injury. And then we are also looking at some of the short-term outcomes. For the all-payer claims data, we are actually also looking at individuals with traumatic brain injury using the diagnosis code, but it has kind of a unique aspect to it where we can look at both short-term as well as kind of the long-term outcome. And Dr. Ajman will talk about how we are also utilizing that particular data for our next grant. Next slide, please. Next slide, please. Obviously, Virginia Commonwealth University has a long history and a really good track record of being one of the centers or one of the sites for the traumatic brain injury model system, and we are leveraging that data as well, and really looking at both short-term as well as long-term goals. Again, this is a longitudinal study, and we've been participating in this particular study for more than 35 years at VCU. The other data set that we are looking at as part of this particular contract is by the Rehabilitation Services Administration, and it's all about employment related outcomes. So again, we are looking at kind of the initiation of services, eligibility of these services, and kind of the long-term outcome is whether individuals with brain injury were employed or not. So next slide, please. So basically, we have over the past few years, we have done several presentations. We are working on 3 peer review manuscripts or publication that will be coming out as part of this particular contract. And something that we are really excited about is so-called a data plan, which would be kind of a very comprehensive report on all these data sets, But it will also talk about kind of, some of the next steps, such as, how can we harmonize this data? How can we link this data just so that we can get a complete picture of the whole trajectory of care for individuals with brain injury as they go from the acute to post-acute to kind of a community-based setting. Kind of a shameless plug. There we are doing like a webinar next week, which will basically be talking about some of these initiatives and some of this work that we have done. So if you are interested, please register for that webinar. In collaboration with DARS, we are also doing a data forum as well as a data summit that will be on April 8th. And we are kind of dividing that event into two parts, the morning session as well as the afternoon session. And the morning session is you can participate virtually via Zoom. So again, if you are interested, I have put a registration link there. And I think that particular event will be really a good opportunity for all of us to come together, talk about the data plan, get feedback from all the stakeholders, and kind of refine it, and we basically submit a final version to DARS by the end of June, beginning of July. So those are kind of our next steps, and I'll let Dr. Ajman talk about what we are going to do with the research study that we recently were funded on.
Hey, Amal, but before Amma begins talking, if I could just let folks know that with your great work, as you know, a number of the members of the U.S. Department of Veterans Affairs Research Central Office are going to be attending in person and virtually the Data Summit, because they're very, very interested in big data in the area of neurotrauma, brain injury, spinal cord injury. And so they're very excited about this. And this might be an opportunity for us to even look at some state veteran specific information relevant to this. So just, I know you've plugged it in the past, but I wanted to plug it as well. It's really nice to have members of, Rachel Ramoni, who runs all research for the VA, was very excited about this event. So sorry to interrupt.
Thank you, Dr. CPU. So Amma, you want to take on?
Yes, thank you. Hello, everybody. So as Amal mentioned, I will be presenting today about our newly funded study, which will be looking at transitions and disparities in care and outcomes for neurotrauma. We're really excited about this project, and I'll be sharing a little bit about what we've begun to do with it. So as the title indicates, a key component of what we'll be looking at are transitions. How do Virginians with spinal cord injury and traumatic brain injury, how do they move from one care setting to another? This is a very important study, and we identify this area because how efficient and how well individuals with spinal cord injuries and traumatic brain injury move from one setting to another is really an important determinant of how they do long term. And so we wanted to look at how we're doing here in Virginia to hopefully help identify some key areas for intervention, for policy change, and for things like that. And so we have 4 important aims that will help us achieve the overall goal of helping improve care for Virginians with spinal cord injuries and Virginians with traumatic brain injury. Our first aim is to look at these transitions that I mentioned. We want to see, we want to describe how Virginians move from one care setting to the other. And the first part of that is looking at the transition or the movement from acute hospitalization to post-acute care settings. And specifically, we're talking about how do they move to inpatient rehab facilities. How do they move to skilled nursing care facilities? How do they move to home health? And then lastly, how do they move on to long-term care hospitals? And then the second part of that is then how do they move from those 4 settings that I just described, how do they move then to community-based care, so and outpatient care? So how efficient are these transitions? Our second aim is then to look at the disparities. And so based on other research areas, and when we look at other medical conditions, we know that certain groups of individuals tend to do worse. And so we want to look at how these segments of the population are doing in Virginia when it comes to how they're moving from one care setting to the other. So specifically, we want to look at how public-based, how insurance types. So the individuals that have public-based insurance versus those that have private insurance, how does that impact their transitions? And then also how do racial and ethnic minorities, so specifically how do non-Hispanic Blacks and then Hispanics, how do they do compared to other segments of the population? Based on previous evidence, we hypothesize that individuals and Virginians that have public-based insurance or those who are from racial ethnic minority groups are going to have less efficient transitions. So we want to see if that bears out in the analyses. Our third aim is then to look at how these transitions affect health outcomes. And specifically, we want to look at 30-day and 90-day emergency department visits, and then also hospital readmissions. So these 2 indicators are, when we talk about healthcare utilization, these 2 indicators are critical markers of how well individuals are doing once they have been discharged from hospital. So we want to see how these transitions affect those outcomes. And then lastly, it would be, we would be remiss if we did not look at how COVID-19 has impacted these transitions. So we want to look at how these transitions were doing pre-COVID and then also during the pandemic. I think initially we thought we might be talking about after, but obviously we're still in this pandemic. So we want to look at how things are looking during this time period. How are we going to answer these questions? Next slide, please. So this is a secondary data analysis. We're using already existing data to answer these questions. And specifically, as Dr. Kamarkar said, we are going to be using the all payer claims data for Virginia for the years of 2016 to 2020. The APCD or all payer claims data is data on all healthcare service information for 4 million plus unique Virginians. And so we will be looking at that data and then combining it with some other publicly available databases to conduct statistical analyses to answer those questions that I mentioned. And then a critical part of this work is, in addition to the data and the analysis, is the involvement of our Consumer Advisory Board. We really are going to be calling on them to not only help us interpret our findings, but also help us to make sure that we're getting we're communicating the findings effectively to the important stakeholders in this endeavor. And so our last slide here, next please. Our last slide is just a list of the individuals who have so graciously agreed to give their time to help us in accomplishing this study. And some of the folks are on this call, but just briefly, just want to mention some of the organizations that will be involved. We were very intentional in putting this group together. We looked at clinicians, administrators, and then we also looked at individuals who are involved in advocacy for Virginians with spinal cord injuries and traumatic brain injuries. So we're looking at obviously providers from Virginia Commonwealth University and Sheltering Arms. And then we're also looking at the Partnership for People with Disabilities at VCU. We're also looking at a representative from the Virginia Health Information. As Amal mentioned, these are the contractors that are working with the database, the APCD database that we'll be using. We also have representatives from United Spinal, Mr. Bagby, and then also from Sportable, Mr. Sloan on the call. And then we'll also be working with a representative from the from Brain Injury Association of Virginia, and then the Community Brain Injury Services. And so again, these, our board will be our partners in carrying out this study and helping us make sure that we're interpreting our results accurately and effectively, and then also disseminating them in the key areas. So that's where we are, and we're really excited to continue this work and then share those findings with you all as we get them. So last slide, any questions? We're happy to answer them.
Thank you, Alma and Amal. Let's see if there's any comments or questions. A wonderful presentation, if I may say so.
This is Kathy.
Hey, Kathy.
Looks like a great project. Love the advisory board. Thank you for your work. Look forward to the outcomes.
Hey, Alma and Amal, I may have missed this because I'm often distracted. Was there a specific timeline on some of your due outs that you could re-highlight for Dr. Reed's benefit?
Yes, so we're going to be having our first, so the study team, we've already started meeting since it's been about a month now. We've been meeting to plan the analyses. We'll be meeting with our community advisory board in April. We'll have our first meeting where we'll go over the aims, the first aim, and share any preliminary findings we have on that. And then we'll be meeting with the board every 6 months. So this has already begun. We've already begun some steps for the study.
Great, thank you. All right, if there's no other questions or comments, we'll thank you for your great contribution time. You're welcome, of course, to stay as part of this meeting if you'd like to listen on. And we'll find out if the team with the Little Brains presentation has made it here. Wanda, do we have any update on that?
They have not joined just yet. Fingers still crossed that they will. I'm sure there's something going on because I just spoke to them earlier at around 8 o'clock. So they're aware. I don't know if they have a difficulty, but we can just move along. And after they join, I guess, just I'll let you know. Okay.
Okay. Thank you, Wanda. That's great. And we could actually give them the option if they can't somehow connect it, maybe they could call in by phone and we could show the slides, whatever, but whatever you think is best. Okay.
Okay. Yeah, I'm in contact with them.
Yeah, let's now move to the next highlighted item, the RFP update. Wanda?
Okay, so here we go. An update on the Services RFP. Everybody's anxious to hear about. Our procurement department has indicated that they have hired and they are currently in place a consulting company that has done procurement for other state agencies to work through the end of summer, by which time hopefully a new team will have been hired. Our purchasing department is lacking right now because a little bit of turnover, but we have the contractors in place, consultants, and we've already been, so the Cni RFP will be assigned to one of the consultants and will go out once they've had a chance to review. Chris and I have actually spoken with our person. They sent us an email last night, and they're going to be meeting with us on Monday morning to discuss the release date. So I did see a date of 4/1/22 as a goal. So fingers crossed that that's going to be happening in the next 3 weeks.
Wow, that's optimistic. Good.
We're very hopeful for that.
Great.
Okay. You're welcome. Next, we move on to
Cni Grantees update.
Cni Grantees update. Very good. Yes. So our Services Grantees update currently on their no cost extension.
First
First up will be Project Achieve hold on just a second. So Project Achieve PI Christine Grow, their no cost extension ends July 30th, 2022. I asked them to send me a couple paragraphs giving me an update on what's going on during their no cost extension. And Christine reports final recruitment push in fall September of 2021 resulted in 8 additional participants, 4 of whom enrolled between November and January 2022. Intakes, initial assessments, and delivery of iPad have been completed for all new participants. 13 of 14 active participants have been contacted at least once since the start of spring 2022 semester. 2 participants graduated December 21, with 1 gainfully employed part-time while also pursuing self-employment as an artist. The second graduate is currently investigating graduate school options. 1 student participant spoke at NatCon 2022 and was awarded Student Veteran of the Year. Research staff presented at Assistive Technology Industry Association 2022 conference in January with the presentation Apps to Support Women Veterans with Disabilities Pursuing Higher Education. Research staff has submitted a proposal titled Meeting the Unique Needs of Women with Traumatic Brain Injuries Pursuing Post-Secondary Education in Virginia to Building Resilient Communities virtual conference. Research staff will be presenting Project Achieve during participation at VHEAP conference in March 2022. Okay, our
Hey,
next.
Wanda, a question based on what you just said. Does it seem like they are on target to complete the job during this extension period? There's a lot of stuff going on, but is there kind of that summary statement? Because that's, you know, that's kind of what we have to target. Are they gonna be able to complete it? What are your thoughts based on reading that?
Based on reading this, I can't remember right offhand. What their final numbers were? I think they're going to be really close, but I don't know if they're going to achieve.
Okay. Well, yeah. So I think it would be good for us to follow up with them to say, you know, that, you know, thanks for this great update, et cetera. Based on this, we will anticipate closure of this project as of this date, and we'd like your final report because, you know, it sounds like they're going to actually be a couple of short of a very low number, right? It wasn't,
Yeah,
you know,
well,
and that's the way it is. Fine, but at some point we got to kind of bring this together, analyze your data, give us a nice report so that we can move on. Because, you know, at some point, you know, it's not helpful, I don't think. Yeah, and also from a research standpoint, getting 1 more person in the next 3 to 6 months is not a meaningful research number. You know, that's my thoughts. I don't know, Catherine and Chris, what do you guys think? I just don't sort of like, let's put this horse out of its misery and figure out what we can get out of it.
This is Kathy, when we gave them a no cost extension, when is that supposed to end?
July 30th this year. So they have considerable
Yeah,
time.
plenty of time. Yeah,
Right.
let's just let them know in advance.
That it ends. That it ends.
We want the report, and, you know, we're going to take what we have, you know, and it'll be wonderful, and they'll do a great job. I just don't want to, keep hearing about, oh, we're trying to get 1 more and blah blah blah. You know, it's good, but because I think that doesn't, you know, we should celebrate the finish of it and what they did find and a nice report rather than just kind of dragging on.
Yes.
Right.
There are no more this is Chris Miller. There are no more anticipated extensions. Agreed,
Good.
Dr. Seefe, that they'll be coming to an end and wrapping this up.
Good. Okay.
Okay.
Were there others, Wanda?
Yes. So next will be Amy Armstrong's enhancing parenting skills of civilians and veterans with traumatic brain injury and their non-injured partners. Their extension will end April 30th, 2022. So it's coming up very soon. She reported parenting workshops. We had several workshops scheduled for this past fiscal year, we had shifted to Zoom sessions. Given the pandemic, we held 2 successful virtually and postponed 3 workshops given insufficient participant registration. We rescheduled these workshops and continued extensive recruitment efforts throughout the state. However, due to limited registration, we canceled the workshops and retooled our efforts to provide the content in a more accessible way. We have struggled with families discussing their needs for this information, with a reluctance for our parents to actually attend the training, given the difficulty of recruitment, and in an effort to expand and sustain the availability of the information, we are recording video podcast sessions that will be housed on the department's website, BIAV, and YouTube. The online material will include informational recordings, participant handbook, and a registration for receipt of the parenting books. Their Train the Trainer, we are offering a Train the Trainer on Friday, March 11th. Today. This will be held virtually. We have 16 participants signed up for the training, and they attached a material. I have that material. They sent it to me, and I would gladly send it to you if you would like to look at it. Trainers will receive a guide, participant handbook, and the parenting books. They will also have access to our recordings once completed. So the project information materials that they sent to me produced a total of 10 fact sheets in 2021 across a variety of topics: couples, cohesion, depression, emotions, family activities, family strong, loving rituals, PTSD, sleep deprivation. Tip sheet production in 2022 on conscientiousness and consistency, faith as a tool for understanding and appreciating. These topics are pending: positive ways to interact, managing stress, positive relationships, how to get organized with a virtual chore chart that promotes doing good. So I have copies. I told you this before. I have copies of all of this material, and I would be happy to send it to you. Just drop me an email after our meeting, and I'll send it on your way. Any questions on that? I do have one more.
Sounds great. What's next?
Okay, next will be a report from Dr. Zena Trost, VCU, Virginia Spinal Cord Injury Outreach and Services Clearinghouse. The original PI was Melody Mickens, and this is also on a no-cost extension until April 30th. She reports, we have worked to maintain the VA SCI website and all pertinent updates and news releases related to the SCI community in Virginia. We have collected data from 150 Virginians with SCI and have been able to successfully connect participants to needed resources. For example, adaptive sports, adaptive gyms, mental health resources in the community, and peer support resources. We have been working to connect with more Virginians with SCI despite the obstacles the pandemic has presented, and have maintained very positive relationships within the SCI community. We are currently working to develop updated infographics that can be distributed to our partnering agencies on the website and to members of the community. We will continue to make the website a centralized hub for resources for the community. Any questions?
That's it. So, I mean, that's a nice succinct summary. I like that. So does that again imply that they're done at the end of April? That sounds like all the tasks are completed. Is that correct?
Yes, that's what I see.
Okay. Great, good. I think that's good. It's best I could tell. And maybe again, I missed it, but the continuation of some of those great virtual resources that they've identified, obviously they don't have the funding to do that. Is that something that there is either they have put together or this group needs to put together a way to make sure those resources are continued? Does anybody have any insights into the different spinal cord resources? Or is that something we want to try to dump on the spinal cord model systems project that just got funded, or someone else, or maybe it's something Rich Bagby wants to take on? I'm just thinking, I hate for resources to die if they're set up and they seem like they're doing well. I don't know what folks' thoughts it might be.
I believe they're just referring to like their website having a bunch of resources on it.
Just there. Oh, well,
I think.
And Josh, is that the spinal cord model system website, which will be continuing, or is that something unique to this grant? Do you recall, or does anybody know? Just because, regardless, whatever the resources they've put together, we should figure out either that they should probably live on a lot of different spots. Maybe something that Rich has got, something that's in the model systems, and maybe something that's DARS, rather than it should, go away if they've put these together. I don't know which website they're speaking of.
So Dave, this is Richard Bagby. I believe they have their own website, which is fantastic, and are planning to disseminate those resources from there. United Spinal plans on drawing from those and sharing them as well. I would recommend incorporating into the model systems grant as much as possible as well. I think they mesh pretty well together.
Yeah. All right. Okay. If it's okay with the group, I will reach out to that team and say, let's make sure those resources live on the model system. Thank. Yeah. And so Josh, what you just listed there, that's not the model systems, or is that?
That's Zena and Emily's website.
Yeah, but is that, I will, if it's okay, folks, I'll close the loop, make sure that becomes part of the model systems if it isn't already. Okay, because I hate to lose the resources in the work.
Dr. Ceci, may I ask a question? This is Chris.
Of course. Go ahead.
To all of the board members, what would be helpful to you as grantees and their work? Would it be to see a report in a certain template and be able to and just be able to have it? Would it be having grantees come to present on the wrap up at that? Do you all have a preference on what would be helpful to you all?
I would love both, where there's a succinct report with appropriate links to references or great things they've done, or manuscripts, but also a 10 to 15 minute kind of summary, as Amal and Amma just did. I know that theirs was an intro one, but a closure one, that not only highlighted what they did, but also what's the continuity, what's the next steps, how are they getting additional funding for another project, to follow it up, or how is it going to live on? Because it's always a shame when materials die, that offer value. So I think both of those would be fine, but I'm open to other folks' thoughts.
This is Kathy. I'd like to see the intro presentation like we just received, as well as a wrap-up presentation. And over the course of the grant, maybe a quarterly reporting of where they are in meeting their objectives. So the process details are interesting, but where they are in terms of their objectives is very helpful.
I always like to see like a calendar of where they're supposed to be, like what's their budget in terms of time and stuff, and then where they are. That's how I'm used to presenting this, and if they are going faster, then, I actually want to know why they're going faster and what they're going to maybe do with the saved resources. If they're going slower, a variance explanation of that, and as I like to know that before they apply for the no cost extension at the end, right? So.
All right. Well, go ahead,
feedback
Chris.
from other board members? Anything else that you all, and what we'll do is start kind of putting this into play as a process, and maybe with some reporting templates for folks.
They already report to me overall summary on how they're progressing as far as their plans semi-annually. So every 6 months, they have to send me a report on how they're progressing with their objectives. So that would probably be something, and we already have it set up in the meetings where we have one closed and one newly formed grant. So that's all taken care of, but I could start sending, if the board wants to see them, I would be happy to send those reports as they come into me every 6 months on how they're progressing with their objectives.
Wanda, let's just talk a little bit. Let's you and I, based on some of the feedback that we've heard today, let's look at whether or not there's a consistent reporting template across grantees so that we're getting similar kinds of information so that when it goes out to the board, it's easy for them to get what they want quickly.
Oh, okay. All right.
Yeah, Wanda, I would love that to be able to see those 6 months report.
Okay.
Great.
Okay. Yeah, that's not a standard form right now, but whenever they ask me about it, I always tell them to go through their objectives 1, 2, and tell me, report to me on each one. So it's pretty well, I think they have the gist of what they're supposed to do when they send those reports to me. So, but we can actually come up with a form, Chris, and it'll probably be a lot easier than them contacting me, every 6 months.
Yeah, I'd find the best form of the last 3 years and then take out the people's names and use that as a template.
Right.
No reason to reinvent that wheel.
Yes, that's a good idea.
Right, and we're glad to let you know that the Little Brains people are here. So if you'd like, we can move on to that.
Okay.
I'm sure they love being called that. Yeah, that's great.
Okay, so just a second, Chris. I just was number 5 before we went to brain injury. It's actually United Spinal. And just to let you guys know, they have just started their no-cost extension on February 1st, so they can wrap up their spending.
Wonderful.
Okay, and now we're ready for brain injury connections of the Shenandoah Valley.
Good morning. Can y'all hear me okay?
Yes, we can, and welcome.
Thank you. Thanks so much for having us. Cindy Nofsinger is our executive director, and she is texting me that she's having some technical difficulties, so she will hop on as soon as she's able to. But in the meantime, I will do my best to go through this project PowerPoint. Thanks for pulling that up, Wanda. My name is Jen Duvon. I'm the clinical director at Brain Injury Connections. And when this project started, I actually was the pediatric case manager that kind of began with this this grant project. So I'm kind of excited to be on both ends of this. So let's go ahead and move through this. If you can go to the next slide. So here's just a quick outline, and I'll try to move through this as quickly as I can. I know you all have precious time. So we'll just go over the overview of the project, the goals and achievements that we made over the past 3 years, some of the challenges and barriers that we experienced, and then where do we go from here? So next slide. The purpose of looking out for little brains. This was to build a capacity of our local community to better respond to children and their families and caregivers who've had brain injury, to also support partner organizations who are also serving these clients. And then, with the goal being to increase communication, collaboration, and understanding among providers and the education system. And then, as a result, to increase the number of children that we are able to serve. Next slide. So our goals were, number 1, to decrease the barriers for children with brain injury by bringing on a full-time designated pediatric case manager. And then number 2, to conduct outreach with the community about the children that we serve and their needs, and about brain injury, to educate them as well. Next slide. So I'll go over several slides that cover highlights and achievements that we had. One big achievement that was a big success was our Pediatric Brain Injury and Substance Use Summit. We partnered with TTAC, and this was held at the university, and we had a great turnout of educators from all over our service area. For those who don't know, we cover the Shenandoah Valley, so Page, Shenandoah County, all the way down to Bath Highland, Rockbridge, and everything in between. So a lot of the topics that were covered during this summit were, of course, related to that intersection of brain injury and substance use. So that was a great collaboration effort, great turnout of educators and school personnel. So we were very excited about that achievement. Next slide. Particularly during the first year of this grant, and we'll talk a little bit more about this, as you can imagine, and the challenges and barriers, but the first year of this grant, we were able to get into a lot of school systems for in-services and professional development trainings to do Brain Injury 101 education to school administrators, educators, personnel, and athletic coaches. So we were able to get in doing those presentations to a wide group of folks on pediatric brain injury specifically, and that was received really well. Of course, the second 2 years of the grant, COVID happened, so that shifted a lot of things, but we were excited about the momentum that we were gaining there that first year. We also did trainings and workshops to community providers, including mental health providers, other therapy providers, some community councils, things like that. We participated in local health fairs, mental health fairs, teen health fairs, community resource fairs. So getting in wherever we could to reach out to families and pediatrics to educate on brain injury as well as about our organization. And then we connected with high school and college sports to do outreach and awareness primarily about concussion for a variety of events like football, soccer, equestrian events as well. Next slide. This was kind of a fun thing we were able to do was a pediatric respite and education basket that we delivered on May Day. And those baskets had some kind of support items, but also were specialized to each family based on their interests, the child's needs, the family's needs. So that was a nice way to be able to kind of lift people up. We did that in May of 2021. So people were feeling, that COVID, kind of pandemic fatigue. And this was just a nice pick-me-up that we were able to offer for our pediatric families. Next slide. We were able to develop some materials with this grant fund that we were excited about as well. We did not really have much regarding pediatric brain injury to offer families before this. And we were able to focus some energy on developing a front and back flyer specifically on pediatric brain injury. We also compiled a special education essentials packet that was able to help sort of arm families that were entering the special education system who had never experienced it before. And if any of y'all have done that, how overwhelming that can be. So we were excited and be able to translate both of those into Spanish. We also produced concussion wallet cards and produced 2 videos related to brain injury that are on our website. So you can see those as well. And we have shown those a few times. They're just animation videos. And then we mailed out magnetic notepads to educators as well with our logo on it and a bit about, brain injury awareness. So that was just a form of outreach that we were able to do for educators as well. Next slide. Some community partnerships that we were able to focus on. One was a pediatric and caregiver support group. We did about 2 per year. I think the pandemic sort of prohibited the last one. But we did host several of those, and that was a nice collaboration between our agency, the university, OT students who volunteered, as well as Centera's Wellness Center provided space for that. So that was a great collaboration. And families came and brought their children and the children's siblings as well. So that was a nice support to add. And then for those who don't know, the Bayard Center at JMU is a behavioral therapy clinic that runs out of the university. It's for the community to serve children and their families, offering parent-child interaction therapy, PCIT. So we were able to fund about 2 clients and their families, I think per semester, to participate in that clinic, which is a great resource and a lot more, specifically tailored to behavioral needs. I'm not sure if Cindy has gotten on or yet. I don't see her. There she is.
Can you see me?
Yes. Do you want to jump in? I'm just flying through here.
You're doing an amazing job. You're doing an amazing job.
Thank
Really
you.
great.
Thank you, Jen, and thank you all for your patience. I'm the executive director, Cni Nofsinger, and I was having technical problems. Could anybody relate to that today? So anyway, if we'll just continue, I don't want to hold you guys up, but here you'll see a slide on challenges and barriers. So pivoting, it's a skill that we've all had to hone the past 2 years. And Brain Injury Connections did a remarkable job, in my opinion, of doing that. In full transparency, during the first year of this grant, our agency hit the ground running, as Jen shared a little bit, and was strong in hosting educational summits, developing videos, educational and awareness materials, and staff was able to actively participate in trainings and really begin to build our pediatric caseload. However, unforeseen barriers were lying ahead with the whole COVID thing, and we had to pivot and convert, be innovative, and try to figure out how we were going to provide high quality services. So, you saw some pictures there of the Mayday basket. That was one of our deliverables, was to have a total of 6 pediatric support groups for the clients and their families. But our families just didn't have the capacity to engage with us in anything other than like virtual means when they had special needs kids at home and trying to manage their own personal jobs. So we did our best to provide video links and that sort of thing to help support them still. Next slide.
One thing that I wanted to mention about the challenges and barriers, as we've said, and that I mentioned earlier, is that unfortunately a lot of the momentum that we did gain in doing those in-services and trainings to the educational system was lost once COVID hit, because schools really shut down, as we all observed or experienced personally, and as well as a lot of the service providers that were serving those. So we are still now trying to figure out what is the most effective way to get into the school system, as it's still, slow to reopen.
Yeah, and I just want to add very quickly, Jen may have introduced herself as such, but when we received the grant funding in that first year, Jen was our pediatric case manager. So she's really able to speak at a first person sort of, not just an observer, but she was actively engaged in serving our pediatric clients and developing some of these services. So I'm grateful that she's here and able to share. Okay, so I think we're ready for the next slide.
Mm-hmm.
Where do we go from here? Our legislative efforts and collaborative efforts. All right, so we've gotten to the end of the 3-year grant and it's been amazing, but now what, right? In terms of sustainability, I suspect many of you all are aware that the Commonwealth is hours from signing day, where proposed legislative bills that have survived the processing thus far will be signed into legislation. Brain Injury Connections has been actively engaged in advocacy efforts for not only our clients, but for individuals living with brain injury everywhere. We are members of the Virginia Alliance of Brain Injury Service Providers, and we also work closely with Brain Injury Association of Virginia to identify legislative priorities and then act on those and encourage our constituents to do so too. So this is really key, and I think it's very important for you all to know that during last year's session, our agency partnered with our local House of Delegates representative, Tony Wilt, and one of our pediatric client parents to promote legislation that ultimately mandated, as of July 1, 2021, that the Department of Education would update their antiquated definition of brain injury to include acquired brain injury. We had our pediatric client was really running into issues trying to get services for her child because he had an acquired brain injury rather than a traumatic brain injury. And so the legislation required a definition change, and it didn't impact just our pediatric clients, but pediatric clients across the Commonwealth. So we're really proud of that. As of current legislation that's on the table, I'm happy to say that item number 330, number 5S, addresses the Commonwealth's gap for pediatric clients and their families here in the Commonwealth. As of today, only 40% of the cities and the counties in the state of Virginia have pediatric case management services. And so we're hopeful, fingers crossed, that things pass and we're able to have sustainability funding for this pediatric program that the grant afforded us to start so that it could continue. Next slide. So as we bring this all home for you today, I'd just like to say that Brain Injury Connections primary service is case management. And this grant inspired our agency to build out specialties among our case managers. We have 3, one of them being a pediatric case manager. The Cni grant provided funding so that our pediatric case management specialists could get specialty training, webinars, specialized materials for themselves and also for our clients, just to inform the work to provide high quality work with our pediatric clients. But case management isn't the only thing our agency does. As you can see in this picture, we are an active bunch. We are small but mighty. And we came together to provide support groups for both pediatrics and adult clients. Education, if you see on the right, we provide crisis intervention team training to inform first responders about brain injury and how best to approach folks whenever they are in a crisis situation with them. We partner with our legislators, community leaders, and other service providers, all to ensure that high quality of programming in the greater Shenandoah Valley. Next slide. So please take note of our contact information. We would love to get some feedback from you all and support other similar initiatives as we hope pediatric case management programs are developed across the Commonwealth. I shared there is a gap. I'm happy that we are part of filling the gap in the needs in the Shenandoah Valley, but also wanting to be able to support others who may want to begin a pediatric case management program as well. Last slide. So thank you. We are grateful. We have accomplished much. We are hopeful to continue the good work here in the Shenandoah Valley, and also, like I said, to support other brain injury service programs in the Commonwealth with similar activities. So thank you all so much.
Thank you for your time.
Yeah, I would just say on behalf of the Cni Trust Fund and DARS, thank you for an amazing presentation, but more importantly, thanks for just unbelievable work and accomplishments, despite all the obstacles and challenges. And you've really done a lot. And I didn't get a goodie bag, but other than that, it was truly an amazing event. And you know, this is the kind of work that we are hoping to continue to support So really, this has been just a fantastic project, and I'm excited as heck about it. So thank you. I would say that there are some similar activities. I'm not going to say they're nearly as good, that are part of the VCU Pediatric Concussion and Brain Injury Program. There's a Children's Hospital Foundation that's supporting, that might be a good partner for you. I'm going to make sure to connect you to some of their leadership, because I can see that bridging a gap and possibly supporting some of your projects financially in the future, because they have some pretty deep pockets in that foundation, and helping kids across the Commonwealth with brain injuries and other issues, acquired or otherwise, and traumatic, are part of their mission. So that could be helpful to you as well. But thank you.
Thank you so much.
Thank
That
you.
would be
That-
wonderful.
That's very exciting, and I look forward to hearing more, getting that connection made.
Yeah, I'm gonna ask Wanda to connect me with your emails and such, if that's okay. That'd be
Awesome.
great.
Thank you so much.
Let me open it up to the other. Let me open up to the other group members for their input, questions, and other observations.
I think it's great work, and thank you so much for doing it.
Thank you.
Thank you.
I echo that. Thank you very much.
Thank you.
And another great work here. And thank you for the work on broadening the definition. That was long overdue. Appreciate it.
Absolutely.
And I hope you don't mind us calling you the little brains people. We mean it in a loving way.
No offense taken. No offense taken.
Great.
Proud to work with Little Brains. Thank you all so much for your time.
Thank you.
And you're welcome to stay on for the call as your time allows.
I appreciate it. Thank you. I think I'll linger.
Okay.
Right.
I get dizzy looking at that picture. All right. All right. We'll move on back to there we go. All right. And now the most important part is future meeting schedules. Oh, no, I'm sorry. My bad. Caitlin's going to present. Yes.
Yes.
Hello, everybody.
Oh, she's ready. Okay, go
Yeah,
ahead.
I'm ready. Hello, my name is Caitlin Berry, and I'm the new Health and Wellness Outcomes Manager here at Sportable. My role was created to execute the Cni grant that Sportable was awarded in November. I think my connection dropped for a second, but I'm back. Okay. So I'm just here today. We have just wrapped up the first quarter of our grant, and I'm here today to answer any questions about the variants that we submitted on February 11th. I believe that should have been emailed out. Wanda, correct me if I'm wrong. Was that emailed out to the board members?
No, it was not.
Oh, it was not. Okay. Okay. So I can share a little bit about what it is, what it says, what we're asking. So our proposal, our study is the developing and testing the efficacy of targeted wellness training in children and adults with spinal cord injury, TBI, and other trauma-related disability participating in a recreational sports program. So part of the first half of our grant, the first 18 months, is developing and doing feasibility testing on a wellness curriculum modules. So my first role was to come in and start developing wellness material based on, and I can read the language specifically. So the research team will spend the initial 3 months of the project developing a structured program covering the basics. Hang on, let me make sure I have it right. 3 months developing a structured program covering the basics of health and wellness. And it goes on to list topics including nutrition, exercise, restorative sleep, heart rate variability, stress management, health habits, social engagement, from a wide range of wellness materials publicly available, e.g. online, in print, and apps, the existing YMCA health and wellness programs, and the VCU cognitive wellness and brain fitness program, CogFit. So when I joined the team, I looked into what was publicly available as well as what was available through the programs listed. So the YMCA Those programs were designed for able-bodied individuals, meaning they lacked essential content related to the specific health and wellness needs and recommendations of individuals living with spinal cord injury and TBI and other physical disabilities. And then the cognitive wellness program was a multidisciplinary clinic at VCU. And that program ended last year due to multiple staffing issues due to COVID. So that program was not currently in existence anymore. So as I continued to survey the available resources, I came across a really robust program created by the National Center on Health and Physical Activity for Disability, which is out of the Lakeshore Foundation and in partnership with UAB, University of Alabama, Birmingham. And NCPAD is the acronym, the National Center for Health and Physical Activity for Disability, NCPAD. They created a CDC-funded wellness program that they've been running for about 5 years now, and that program transitioned to fully virtual as of COVID. And they've started to expand that program to partner sites. So I've secured a partnership with NCPAD to execute their wellness program as our wellness program. They're going to be training us to execute it. So that was a lot. The overall kind of key part of the variance that we're requesting is that we are requesting to replace the wording that says from a wide range of wellness materials publicly available, the existing YMCA and the VCU CogFit, replace that wording with or identify and using an established evidence-based wellness program that covers the basics of health and wellness and is appropriate for the athletes that Sportable serves. So changing that wording so that it is more encompassing and allows us to use the mentor program for our wellness program. There's some other related changes, subsequent changes because of using the mentor program. The mentor program is more robust. So our initial wellness training was going to be 10 hours. This will be 40 hours. The initial wellness training was going to be across 3 months. This will be across 8 weeks. But again, it is a very robust training that includes, it meets 5 times a week virtually through our partnership with NCPAD. They're going to be helping send workout equipment and even grocery delivery to help with some of the nutrition classes where the participants cook in real time. So it's really just wonderful program. And Wanda, if the variance request can be sent out to the board members, I've also included a citation for a study that came out last year where they really cited a lot of the strong benefits that they've observed through the program so far. So again, that was a lot. I want to open it up to any questions about any of that.
Caitlin, if I may, obviously you and I had a meeting. You shared this with me, and I was blown away. I thought I kind of knew some stuff in this space, and it's amazing what their program has to offer. And you know, I'm jealous, and more importantly, I'm really excited about making that this connection that you've done. And you've already earned. You can tell Hunter you've already earned your salary for the year. There's an amazing connection and program, and this is really evidence-based wellness for people with disabilities. So it's great stuff. And I think everybody on this call should probably be part of the program. We could all use a little buff, but it's great stuff. So I'm not to over-influence the group here, but it's some really great work. And thank you for joining Sportable, for upgrading this program. It's fantastic. I'm excited to see what's going to happen.
Yes, we are very excited too. And honestly, my outreach to NCPAD was initially just a call of like, hey, what is this? Can I learn more? And it was just really good timing where they're looking to expand the program and expand its reach across the country. And so it just was a perfect timing and a perfect partnership that we needed a wellness program, and they wanted to expand who they could offer it to. And it was designed specifically for individuals with disabilities and designed with a lot of feedback from individuals with disabilities. And it's customizable. It's always changing. They're going to want feedback through our participants going through it. So the feasibility elements will absolutely still be there. We'll be able to customize it as needed before jumping to our second half of our Cni grant, the second 18 months, when we'll look at a comparison trial of our athletes participating in sports alone versus sports and this wellness training, and seeing if there's enhanced outcomes.
Sounds wonderful. This is Kathy.
Great. One other piece I didn't mention. So we have, through our grant, we have our wellness committee, which is made of community leaders and doctors in this space. And so they have also approved our use of this wellness program. So part of our proposal said that they would review and approve any wellness program that we use, and they've all read through everything and have approved it as well. So our final step is just making sure that the variance is approved and that we will move on from here to start getting trained on this program and then begin executing it.
Any other comments from the board? Any concerns, questions? Otherwise, do we want to wait till it's distributed and then do a motion, or do we feel comfortable doing a motion now, Catherine? Yes, I like the way you're shaking it. All right. So there's a motion on the table that I've just put out that we're going to approve the variance as written or as described, and then imagine as written. And I'll ask my colleague, Dr. Reed, for a second on that motion.
I will second that motion.
Thank you, sir. Is there any discussion on the motion? Otherwise, we'll call the question. All in favor, visually or audibly, aye.
Aye. Emphatic.
Aye. Otherwise, nay. I don't know how you visually do that. Nay or nay.
Dr.
All right, it passes unanimously. Thank you, Caitlin.
I think you have to do a roll call.
You have to do a roll call. You know we like.
Oh, yeah. Well, even though we're video, okay. So vote. Yes, Dave Seafew. Rich Bagby, your vote.
Emphatic yes.
All right. Catherine, I'm not sure if you're a voting member, but I'll assume you are. Catherine?
Yes.
Yeah, all right. Who else we got? We got Chris Ann. Oh, Heather.
Heather's a yes.
All right.
David
Josh.
Reed.
I'll let you do it, Wanda.
Thank you.
Was that my name?
Yes.
That's a yes. Yes.
Josh Sloan.
It'd be a yes from Josh Sloan.
Sure.
Very good. Rennie did not join the group, correct, Chris? Rennie? No?
Correct.
Okay. That's it.
Wonderful. The motion passes unanimously. Again, thank you, Caitlin, for great work and presentation. We look forward to the results.
Thank you. I look forward to sharing them.
Okay, next agenda item, Wanda, Cni meeting schedule.
Just everything's been cleared up. There was a little snafu, but we're all good. And the June meeting has been moved from the second week in June to the third week. So I'll be making that change and sending it out probably this afternoon. The date will now be June 17th, 2022. And the two remaining, the September and the December meetings, it can remain the same because September's the third week and December's the first week. And the conflict was only for the second week. So we're all good.
Thank you, Wanda. I appreciate it.
Wanda, have we confirmed with all the board members that change in date works for them?
I did not, but I guess I'll find out when I send out the invite.
Or right now, either way. Yeah.
So what are the three dates again? June 17th and September?
Gotta pull it up. Hold on.
The only date that changes, Kathy, is the next date. The other dates are the same, and you already have invites on your calendar.
Okay. Thank you.
Wanda, will you just tell people the proposed date for the next meeting?
Okay. June 17th?
Yes, Friday, June 17th.
Is there anyone that cannot make that date?
I cannot make that date.
And Wanda and folks, I can still do it. I just have that couple of 5 to 10 minute overlap where I sometimes can't be there. That's my only conflict. I do my best to rush through that VA VCU meeting. So
we could start
I don't want to mess it up
9:30.
for everybody. Yeah, or even 9:15 would be perfect. I feel bad taking your time away while you're just looking at me talk without voice, without sound. So I can do it on that day. one, I just have to tell you, there could be a little bit of a buffer of 15 minutes. So if 9:15 works, that's perfect for me.
Dr. Sepia, we need to be prepared that this will have to be an in-person meeting. So do you need more time given that?
Oh yeah, yeah. Unless I do it in my car, which is kind of embarrassing, the VA meeting. So yeah, it would need to be 9:30 because I could start driving at 9:15 and make it to your place.
You're also
So why don't we do
welcome
that? Let's keep it the 12th or whatever. I'm not the 12th. That's stupid. Let's keep it the 10th. And if we can do 9:30, that would be most appreciated. And I will, you know, come hell or high water, whatever that even means, I will be there. I doubt either of those will be in my way.
That's we really appreciate that. And also, you're welcome to use like my office if you want to come early. And if you're doing your other meeting virtually, you can come use our offices and do that.
Okay, thank you. Appreciate that offer. Thank you. All right, thank you for the flexibility. All right, anything else related to that? Probably not. Are there any other elements that we need to cover before we adjourn? Anybody? Wanda, Catherine, Chris-Ann? Hearing none, I thank you all for a wonderful meeting and for ongoing support and leadership in this program. And we stand or sit adjourned. Thank you all.
Thank you.
Thank you.
Have a great day.
Thanks, everybody. Good to see you.
See you. You're muted, Chris.
So we are still live streaming. So if you all would go ahead and log off the call, log off Zoom, and I will let Betsy know. So please leave the Zoom. Wanda, go ahead and leave the Zoom.
Oh, it's telling me I'm host or something. All right.